If we look around in Pakistan, one survey after the other, there are about 40 million people suffering from diabetes. So let's talk first about what Dream Diabetes stands for and what the Dream Diabetes Project stands for. So I have put few questions, few suggestions in this and thought maybe is that the Dream Diabetes that we have? If we look around in Pakistan, one survey after the other, there are about 40 million people suffering from diabetes in this time and date. And the worst part is, half of these people, and we did a survey with the help of our friend in Peshawar, Dr. Amir, and us got together and did a survey. In that survey, 10% of the people who came in for screening who had diabetes did not even know about their diabetes status. Number one. Number two, the important part, at any given time, even in the civilized world, about 50% of the people who have diabetes don't even know that they have diabetes. So if you have a number which is like 10 people in this room who have diabetes, there will be 10 people in this room who have diabetes who don't know. One country which shows right in your face is Pakistan. And why is that? Why are we number one? The prevalence of diabetes in Pakistan is more than 30%, which is the top most country in the world with the prevalence of diabetes. So is that the Dream Diabetes Project that I have in mind? Actually, no. So what is Dream Diabetes Project? I was looking at the statistics of diabetes care, the facilities, and looking at the specialists available for the people who have, so looking at the number of people who have diabetes and the availability of specialists to them. The numbers are very surprising. So if you look at the general population, for almost 1.1 million people in Pakistan, you have one specialist of diabetes, if you call a post-graduation in diabetes a specialist. What about the diabetes? For 200,000 people with diabetes, there is one specialist. And again, if you look and you go to Balochistan or KPK, the ratio goes up even higher. So you could have like a million people suffering from diabetes and you could have one specialist available for taking care of them. Is that the Dream Diabetes concept I had for my project? Actually, no. Other part, sometimes when you're living day to day, you don't realize. But when you're practicing medicine, and my colleagues would know that if you're practicing medicine, you would realize that you're seeing the patient in your clinic, in your busy clinic, and you're spending 10, 15, 20, 30 minutes in your practice, and you see that he has traveled from Quetta to see someone in Lahore. The driving times, the traveling times of these people suffering or affected by diabetes is huge. Is that the Dream Diabetes Project I have in mind? No. These people are traveling long distances to get to the specialist center when they need to get to. If you want to compare these statistics of traveling distance and the ratio to the doctors versus, if you look in the Western world, like I'm trained at US, so let me give you an example of where you would find a specialist for a diabetic within a 30-mile range if you live any place in US. And for a 65-year-old diabetic, they will about 6,000 patients can find a specialist in the area of wherever they're living. The concept of Dream Diabetes is that if you cannot bring, or if you do not want to bring the patients to the specialist, how can we bring the specialist to the patients at their hometown? And again, that was a dream that I had before I started this Dream Diabetes concept. So it's an environment in which we are trying to build, in which we can see that there is a patient, a doctor, a healthcare provider, which would be a diabetes educator, and an environment where all 3 or 4 of them can communicate along with the family to take care of the diabetes in the Dream Diabetes Project. So for me, the sentence leap of faith has a different meaning, and I'll show you what do I mean with this. With a leap of faith or the jump of faith, what we mean is we move towards a targeted goal, we run, and there comes a time in every entrepreneur's life, in every professional life, that they have to actually jump to get to the farthest towards their goal. So that's what you call a jump or a leap of faith. I would slightly modify it, and I will call it the hop, step, and jump of faith. So just to let you go over what hop, step, and jump means, even in this competition, which happens in the Olympics, the aim is still to jump in the direction. And as an entrepreneur, you would ultimately want to jump. But this is slightly different than the long jump. What happens in this is, you run towards your goal, that's the race part of it, then you hop. What it means is, whatever leg that you jump from, you land on the same leg, and that means that you try to explore in an entrepreneurship, that you try to do something that you were racing and you're practicing in the past years, to do something on the same lines. The third step in hop, step, and jump is stepping it. So you diversify at that time and use the other leg to take a step, and then you jump and wait for the results to be farthest away from where you started off. For me, coming back and practicing diabetes was my race towards my goal of reaching the ultimate goal. But how did I hop? How did I take the jump and land it on the same way? I started doing capacity building for physicians. Today, I'm still doing it. We design programs for the general physicians, we make courses on diabetes, and I'm being part of international collaboration with names like Weill Cornell, Imperial College, all these colleges. We got together and we made capacity building programs for general physicians. So that was a hop towards getting to my dream diabetes project. What was the step of it? And I would say step was more of an accident or something which was pushed on me because of the nature, and that was COVID. So the COVID happened, my hospital became the center of COVID, and again my clinic was right in the center of it. I could not practice diabetes who were already immunocompromised, come to the hospital and get treated. So what do I have to do? I had to start telemedicine. I started telemedicine and I started looking in different ways how to treat people. And long behold, surprisingly, the outcomes, and as I showed in the studies as well, came out that actually patients were getting more satisfaction because they could spend more time and be at the comfort of their home and were treated for diabetes, and the results and the A1Cs were even getting better. So that was my step towards a different module, and hence the last part of it, the concept of dream diabetes came into existence, and that's what we're going to do. What is dream diabetes? And again, the last few minutes, I would like to tell you what dream diabetes is. Dream diabetes is a model and an environment in which a patient would be able to stay in their hometown, see their own physician, be in their own facility, get treated, get examined by their own doctor, and whenever needed, they could reach out to the specialist. So if you look at the cartoon here, you can see that in your own facility, you will be taken care of, and advice for doing something in diabetes will be given to you through a telemedicine concept. So number one, your patients are not moving. They're in comfort with their doctors and they're comfortable being treated by their doctors. And lastly, they get the best of the advice that they could through connecting to the consultant. I wanted to share this story to you because there are ways, there are challenges that all of us face. I've shown you the disparity between the number of consultants who specialize in diabetes, but there's always a way out of how to manage these situations when you go about it. So here's my story on diabetes, dream diabetes, defeating diabetes for you.